I worked in healthcare IT for 20 years, and I have seen where the bodies are buried. I've seen the good, the bad, and the ugly, but I came to this conclusion that the more that this place touches healthcare, the worse it gets. And so some of my questions and my thoughts are the only thing that's going to save the healthcare system is innovation and disruptive innovation. So I'm going to gear my questions in that regard. I think telehealth is old technology, but at least it's here, and at least we have that. So Mrs. Watts, can you talk about the impact of the pandemic and how that has ushered in more telehealth, finally gotten some level of adoption that really was resisted for quite some time?
The great thing about telehealth during the pandemic was that people that had never tried it before and tried it, when we surveyed and said, will you do this again? They said yes. I mean, resoundingly, they said yes. And so I think it was a great way to try it out. But I also think it did a huge service to healthcare providers in this country because it kept people out of the doctor's offices and going to the hospitals. And it was a way to triage. And so it was really, kind of a godsend that we even had that as a resource for people to access to determine whether or not their symptoms were related to the pandemic, to COVID or something else. And
in addition, it gives access to patients who might be in a rural healthcare setting that have very difficult times getting an appointment with a psychiatrist or some of these specialists. So that's a huge added benefit as well. Can you elaborate or give us an idea, what is holding this back? What kind of structural issues are throwing water on this innovation?
Oh, I think that virtual healthcare, digital healthcare are all very fast-growing segments of the market. And part of that is driven by the fact that there is a shortage of providers and people aren't able to get an appointment. And so access to virtual digital care definitely helps. But the other thing that's so important related to behavioral health is that it has really helped us address a health equity issue with access to behavioral health in seeing low income and minorities be able to access care that they really didn't have access to before.
So let me ask this, and this may be a question for Mr. White. Do we have an issue with, I know state after state, they implement licensing laws. A lot of it is turf issues. Do we have, as a nation, as we approach this increased demand for professionals and people to get access to care, whether virtually or in person, what is the impact of these restrictive licensing laws where they stop potentially mid-level providers from practicing to the fullest extent of their education?
Yeah, great question. And maybe to answer your last question, I think what we saw during COVID was the public health emergency was declared and the government flexed up all the rules. And what did we see? We saw innovation come into the marketplace, right? We deployed and empowered pharmacists to deliver care to patients, to fill gaps in access, which is a really critically important strategy. 250 million vaccinations through the pharmacy channel as a result of some of those policies. But also tests, being able to deploy prescriptions for people who are sick, et cetera. We saw telehealth, which was a massive gap filler once those rules came off, and care at home. Right? We do a lot of care in very expensive settings that we could actually deliver in the home now based on new technologies and strategies. So with the licensure issues, I think what we've seen is we essentially have a really maybe a 15th century guild system, like with blacksmiths and and not to denigrate medical professionals, they work hard and get licensed and do their things. But what I think we realized during COVID was you can deploy these mid-level or more junior-level medical professionals to deliver.
Right, and my time is getting close, so I want to move quickly into this. I think it's my opinion that AI is going to could radically change healthcare to the point where it empowers someone who is a mid-level to be more of an expert in diagnosing, more accurate, provide better healthcare standards than our the best medical professionals we have today. Could you elaborate?
And will lower costs. I was in Iowa last year where you've got ophthalmology techs using AI to detect diabetic retinopathy and screen out the people who don't
they're
need
just
the surgery.
techs. Yeah,
they're just techs, right? So we have a massive shortage of diabetic techs in this country. You plug the machine in, you run them through the tech, and they get the people who really are going to need the more hands-on care from the physician. It works beautifully, it lowers costs, and it gets people the access they need.
Thank you.